It's time for Wellness Wednesday. We bring in Dr. Bradley Meyer from Okoboji Wellness Clinic. New year, new health goals for a lot of people, and that means feeling great, not just getting by. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, everybody. Happy New Year.
So
Glad to be with you again.
We're thrilled that you're with us. So the goal in 2024 is not just to make it through the day, but it's to get out there and thrive and enjoy life.
That's a good goal, and we're going to help you achieve that here when you come see us at Okoboji Wellness Clinic. So we're the place to come to get those answers. So when you are struggling with a lot of things that we might put off to aging, or I just kind of got to deal with that, or I've looked a lot and still haven't found answers, we're the place to come, because we're going to look in areas that haven't been looked at in most cases, and our goal really is for you just to have that improved quality of life. So that may mean more energy, more time and energy to do the things you want to be able to do with friends and family, and those to attain those life goals. So I just encourage everybody to take a look at the different programs we have. We've got the direct primary care membership. It's a monthly membership for $99 for the individual, $179 for a couple. And then there's family plans as well that you've got unlimited visit, longer appointment times to come into the Okoboji Wellness Clinic and really get to the root cause of what's going on. So it can be a fun journey as we peel back the layers. And one of the things that we're oftentimes doing is building up tolerance for whatever the injured part of the body is, building back tolerance with that. And we're looking for the toxins, the things that are in the body or that the body's still exposed to that are causing it to be unwell. So, if we're doing a good job of working at different parts of the body and removing toxins and triggers, then when that cold that's coming around comes along or we're exposed to it, we're more apt to not get as sideways, not get as sick. And so there's a process to this, and it's a stepwise process. It's like, again, I call it peeling back the layers of the onion, and we have a lot of different tools that I'll recommend in the clinic to get there. But it can be things such as stubborn coughs even, where things like that are hanging on for months upon months. What can we do with that? Or it's that sour stomach that, I get bloating every time after I eat. And I don't want to just have to be on a proton pump inhibitor or an acid reducer the rest of my life, because I know that can reduce the absorption of vitamins and minerals and lead to other problems down the road. So we want to look at, again, trying to get to what is causing the problem, and then seeing if we can help the body get back on track to healing. And for instance, yesterday we had a young gal that was in, and when we worked on those layers, and it was pretty amazing. You could just see over the history all the different things that had kind of lined up over time, and so then we just kind of worked backwards, and we're okay. How do we help bring that body back to the stable state, and where it's able? And again, it's some of that, whether it's hyperbaric therapy, stimulating stem cells with that, and working on increased oxygen and voltage to the body. Hyperbaric is one of the greatest tools. So, come on in for that membership evaluation if you want to come in and get going on that, or if you just want to come in and you've got something that's been bugging you and you want to do a routine one-time visit, do a consultation with me, give us a call for that as well, and we'll be able to help you walk down the road and get you closer to where you want to go.
One of the things we need to talk about more with the direct primary care, if somebody's really sick, maybe you're full, but you still might be able to squeeze a video call into somebody and help them out.
Absolutely. Yeah, we'll really work hard to get folks in same day. Better availability. I know it can take sometimes days to weeks to get in with the primary care provider in some cases with us, because we have a smaller empanelment size That means we don't have as many people as part of the membership as in a conventional system. So that allows for me to see less patients during the day and squeeze more things in that need to be seen that same day. And that, you're right, that might mean if somebody's from a distance and they can't make it to the clinic, we do a televisit over the computer, and we get you going that way.
You know, and there's lots of things to consider, and we want to make sure that, I mean, if you believe that the proper route is a normal prescription type medicine, certainly that's what you're going to do. But if there's something else that might work, you might want to try that route as well. You're open to both.
Absolutely. So I look at myself as a bridge. I was conventionally trained. I'm a DO, Doctor of Osteopathic Medicine, family physician, board certified. Been doing family medicine for at least 15 years. Was in the Air Force as an Air Force doctor. I've seen kids and seen the elderly. I've seen a lot, and so I've worked in the venue of conventional medicine for many years, prescribing traditional medications. Now, of course, the last 3 years, during the COVID era, I've had my eyes open to some other ways to go about helping the individual on their pathway to getting better and healing, and so that's where some of these things like herbals, homeopathic, more holistic products, supplements, and then some of the different modalities that we offer at the clinic here, whether or not it's frequency treatment versus hyperbaric. We have multiple modalities, functional nutrition visits with Molly. These are the things that I've come to have extreme value for, because a lot of times in the conventional system, if you get a grouping of symptoms, it's put into a diagnosis. That diagnosis then is giving a prescription, and with the prescription can do an okay job at when we need it to lower blood pressure or whatever it may be, but maybe you want to take a different path. You want to see, well, how can I see about getting that blood pressure down without a prescription? We can go that path as well. Or how can I work on my thyroid? Or how can I work on my acid reflux, my gut health, my brain health that is not necessary, my depression, my anxiety? How can I work on it in ways that aren't with a quote-unquote pharmaceutical prescription, but more of a holistic approach? And so I'm a bridge. I'm unique in that way because I've had the training in that conventional way, but then I'm able to kind of work you towards more of a holistic path if that's the direction you want to go.
Well, we're out of time here, but these are topics we could easily spend an hour each on. Gut health. Since you've come on board with Wellness Wednesdays, we've learned so much. Red light therapy, hyperbarics, inflammation, gut health, diet, processed food, grounding. Didn't know a thing about grounding. Some of these things have extraordinary value, and no one's even really talking about some of this stuff.
Yep, absolutely. So it's a pleasure to offer something that may not be in your regular vocabulary vernacular, to come on in and say, okay, these are the other tools in the tool belt that we can try, and let's see if we can get you feeling better. And so you can call us at 712-339-6024 and ask any questions or make an appointment. And then we are at 3305 Berquist Avenue in Spirit Lake. We're just off Highway 71 behind the Okoboji Pancake House in the building just north of Ace Fix Hardware. So we're happy to answer those questions, give you a tour of the clinic, do a hyperbaric consultation to get you going on your hyperbaric journey, which is good for so many different chronic conditions. That's kind of a one-size-fits-most. So, excited, new year, new you, and don't just accept the fact that, this is the way I got to deal with all this stuff that's bugging me. There are answers out there, and we're going to help you find those answers. So just come on in and let us be part of that walk with you.
Very good. Dr. Meyer, Happy New Year to you, your family, your amazing staff, and we look forward to helping people on Wellness Wednesdays throughout 2024.
Sounds great, Dave.
Thank you,
Best to everybody there. Bye-bye.
Thank you, Doctor. Dr. Bradley Meyer, Okoboji Wellness Clinic. Find them at OkobojiWellnessClinic.com.